have to have classic COVID disease in order to be a carrier for the disorder. The other important aspect of the disease is that there are currently no therapies that directly treat the disorder. The therapies are what we call symptomatic management. And that's important to realize. The disease course is highly variable, but one of the key factors that influences the natural history of disease is underlying medical conditions. So people with asthma, people with chronic obstructive pulmonary disease, immunocompromised individuals, obese individuals, anyone with cardiomyopathy, we know from the population studies that have been done that these are the higher risk groups with respect to the course of COVID disease that they have. So when you look at the disease from a population perspective, and I think it's important to realize that this is looking at the normal population or a large population within North America, is that some patients have very minor symptoms while others have much more serious and potentially fatal symptoms. There's different phases of the disease. The acute disease symptoms are fever, chills, loss of smell, a quite extreme fatigue in some individuals, but most importantly and tragically is the shortness of breath and the inability to breathe. In fact, the acute disease can evolve very rapidly in patients and can lead to ventilation or oxygen requirement, and can also be fatal, as you've probably heard in the news. The other symptoms of diarrhea, runny nose, and sore throat that are more common with influenza and other viruses are not so common in COVID-19 disease, but have been described. What's also important is that some patients develop what's called a multi-system inflammatory response. So this can lead to very serious multi-organ system involvement, kidney failure, cardiac failure, severe neurologic disease. And this is something that is somewhat unique to COVID-19 and is still an emerging group of symptoms or complications which we're beginning to learn. There's also another phase of the disorder which is not well described, at least in the lay press, but is being well described in the medical literature right now, is this prolonged phase. So patients can recover or have a relatively mild or moderate course of COVID, but it can carry on for a long period of time. So some patients are reporting prolonged fatigue, prolonged oxygen requirement, and prolonged neurological compromise many months after their initial symptoms. So that's basically what COVID-19 disease is. And so I think it's important for people to realize first the decisions they're making around the disease. So the factors that relate to MPS patients is we know from our own experience, and myself and Dr. Greenberg and others, we've had 20, 30, 35 years experience. And it's very clear that MPS patients, even with a common cold and with other aggressive infections like influenza, can have significant medical complications, even if they are relatively stable from their MPS. So we already have experience in how fragile MPS patients are when it comes to infectious disease. And some of the key issues for MPS patients is really related to their abnormality of lung function and what we call the pulmonary reserve that they have. And that pulmonary reserve can be quite restricted. So this is both the primary disease, the MPS itself, but there's other patients with MPS like MPS 3 or later stages of the other MPS disorders, where they can have additional pulmonary effects related to aspiration or reflux that, of course, could be made worse during a COVID infection. The other factors that are important for NPS patients is that we know that the upper and lower airways are very fragile in NPS patients. And this is particularly an issue with the Morchio patients, that their trachea and larynx and upper airways can be very fragile. And so in an inflammatory condition, this can lead to compromise. Of course, we know also that the heart is involved in mucopolysaccharidoses. And so these are potential risks for patients who have NPS if they have underlying heart disease. And so we know that the degree of underlying disease burden is likely an important factor for the risk of COVID infection in NPS patients. But even in attenuated patients early in their disease course, it may be difficult for us to predict how they would respond to a COVID infection, and even transplanted patients who have been doing well post-transplant. The other important risk I think that we need to put on the table for NPS patients is that we now understand that NPS patients are actually in a chronic inflammatory state to begin with. And so we are not sure what would happen with a virus like COVID-19 with respect to augmentation of that pre-existing inflammatory state. So that's important to realize the potential risks that the individual NPS patient has. And so how is this virus transmitted? Again, this is evolving science or evolving evidence. But currently, really the strongest evidence points to spread from person to person, mainly through respiratory droplets. So things like coughing, sneezing, even talking, which is why we're now beginning to see, as the communities are opening up, people who are having parties in their house and having 10 and 15 and 20 people over who are merely talking in the closed room are transmitting the virus. And what happens then is you inoculate a mucous membrane. So it's breathing in particles going into your eyes, having your hands directly touch someone's secretion and then touching your eyes, rubbing your eyes, or touching your mouth. Transmission from surfaces is felt to be possible, but it's not felt to be a major contributor to transmission from a public health perspective. But I've listed here on this slide, timing may be important here, meaning that the tabletops and chairs are probably not a big transmitter, but if you share a spoon or a fork with someone, or you take someone's pen who has just had it and you put it in your mouth, that timing may be important. So it's clear that the key issues of spread of this virus relates to physical distance between people, so it's droplet spread. Also the ventilation of the space. And I mention that because depending upon the type of school and the age of the school and whether classes are sometimes classes are in a trailer, it's important to realize that a ventilation may actually be a factor in transmission of this virus. And any respiratory exposure to people who may be carrying the virus is a potential issue. And physical sharing of items directly over a short period of time might be an issue. So when it comes to schooling decisions, there's really a lot of variables to weigh, and I think this is what we're probably going to discuss more of today, is there's variables of medical issues, meaning what is the burden of disease that you have. There's also, of course, financial issues. A lot of families need two incomes, so keeping a child home and homeschooling may not be as easy. There's also psychological aspects, which we'll talk about today. The other important aspect of schooling decisions is that there's going to be large differences in regions. And these differences are going to be reflected in the resources that each individual school may have, and their ability to put together a good program to protect children is going to be different from city to city and region to region. The other important aspect, I think, for parents to have with respect to decision making is this pandemic isn't going anywhere quickly. And so this is going to be an issue through the whole winter semester, without a doubt, and probably at least to the end of 2021, of summer of 2021 or longer. So I think that's important with respect to knowing the gravity of decision making here is that this is not going to be a flash in the pan, a pandemic. This is going to go on for at least another year. The other important aspect is that your decision making and our knowledge in this area is going to be a moving target. But I think the moving target is going to be related to increasing severity or increasing risk over the next 8 months, as opposed to decreasing risk, meaning things are not going to look brighter and better by November or December of this year. If anything, they're going to look worse, or potentially look worse than they are now. So I think some of the key points as you begin to make decisions for schooling, and this is also just sort of emerging over the last couple of days and weeks, is that the choices that you make for your child may limit future options. A number of the school districts have now stated that if you choose to do homeschooling, you will now be taken off the list for your school district. And if you want to go back to your school district next year or next semester, you will have to reapply. Now that has implications for certain regions of large cities where once you're out of a school district, you may not be able to get back in for 3 to 4 years. It's also what seems to be emerging is that your choice with respect to schooling for your children, you may not be able to reverse that choice quickly if it doesn't seem to be working for you. So the schools don't seem to be showing that they are open to families trying things out for a month and then going back to something else. So I think that's going to be really important to consider in decision making. The degree of disease burden that individual patients have clearly are going to play a role in their risk. But I think it's important for families to realize that it's difficult to predict that risk. So I think you need to talk to your medical team or your doctors that are involved with the care of your children and begin to discuss that. What is the residual disease that that individual MPS patient has? And can you have a discussion with that medical team what they think your risk may be should you contact COVID? But you also need to go to the school and discuss specifically the school plan and the choices that the schools may have. And so I think it's important to explore with the schools, are there options for virtual learning, or some schools are calling this distant learning, or some type of blend between virtual learning and class learning. Also, you should directly ask your schools, do they have any specific plans for immunocompromised children? And it's important to ask that question because your school may have a program that they've established for cancer patients, not realizing that those are also perfectly appropriate or are completely appropriate for MPS children. So rather than ask them, what are you going to do for my MPS child? Ask them, do they have a program established for immunocompromised children? But you also need to, of course, if you're deciding to attend a school, is to ask them, how will physical distancing be implemented? Because we know that that physical association of children is going to be the biggest factor with respect to spread. And also, not only what type of physical distancing are they going to implement, but how are they going to monitor and enforce it? It's one thing to have a paper protocol in place, but how do they plan on reinforcing it? And do they have the infrastructure in the school to implement and monitor what they set up. But also, of course, these questions pertain not only to the class situation, but to other areas. When the kids are in recess, when the kids are on breaks, how are they going to make sure that physical distancing and spread is kept small? There are some schools that are talking about these learning groups of having a small number of children together at any one time so they can police who gets infected and who's potentially at risk. You need to ask questions of how those learning groups are really going to operate. You also need to ask, with respect to high traffic areas at schools, the entranceways. Are they going to allow all the kids to show up at 8 o'clock in the morning and pack the front entrance of the school and then have the physical distance later? So you really need to ask and be shown how entranceways are going to work, how administrative offices are going to work, how bathrooms are going to work. Are they going to monitor the number of children going in and out of bathrooms? You also need to really ask the school, how will symptomatic individuals be dealt with? Little Johnny gets dropped off at the school and he looks ill in the morning. How do they plan on dealing with that? And it's not only the children. How are they planning on dealing with teachers that become ill or staff that becomes ill? And that's going to be important to how your children are protected in school. Also, how will you be notified if there's an exposure? If there's a positive kid, or if there's a kid that's been in the class that's ill, how are you going to be notified about that? The other important aspect is how will hygiene be dealt with? And again, there's going to be such regional differences. Things like hand washing, cleaning of common touch points. How often are those going to be cleaned in the school? And does the school have the proper monitoring and supports in order to make sure that those high touch areas are cleaned on a constant basis? Also, how common are common areas going to be cleaned? The common areas of the school, the desks, the chairs, the bathrooms. Does the school have something in place in order to reduce the risks of exposure in these common areas? So this, I think, is a good kind of capsule for sort of the areas that you all need to consider asking questions for and having a comfort level on when you're trying to make these complex decisions. So I'll stop there, and we'll hear from Cheryl and Eva.
I think you're on mute, Doctor.
Now I'm okay?
Yeah.
I should get started now?
Yeah.
Okay. Well, Lorne, I'm not sure how I can follow your act. Of course, it's not an act. Dr. Clarke and I have known each other for many, many years. And I'm the middle speaker in this webinar. And I kind of feel like the middle child, I'm surrounded by a medical expert like Dr. Clarke, who's really giving us an overview of all the things that we have to be considering now. And I'll be followed by Dr. Mamak, who's a neuropsychologist, who understands intimately what are the psychological issues that you're facing. So I'm in the middle. And when Kim put out a request for members of the Medical Advisory Committee of the MPS Society to present at this webinar, I said, well, I would be very happy to, for several reasons. First of all, I'm not presenting this as a medical expert, although Dr. Clarke has said correctly, I've had lots of experience, but I'm not currently treating MPS children. But I felt a serious obligation to participate in this webinar because I know how difficult a time it is, not just for parents and children and individuals affected with MPS, but I want to make sure people understand that this is a very difficult time for health professionals as well, including doctors, such as myself, Dr. Clarke, Dr. Mamak, and some of us are in high risk groups as well. So this is a very difficult time for everybody. 2020, I never would have predicted, who would have predicted this would have happened? But there's a couple of things I want to say. I want to say a few things in my perspective as a doctor. And for each of you, regardless of where you are in Canada, doctors have an obligation to follow the recommendations of their medical colleges and to make sure that they are listening and providing their patients and the families with up-to-date information or how to access up-to-date information. Now, I know all of you are probably much more expert than your primary care providers about MPS disorders. That is true, but you also need to know that the health professionals are learning now on the fly as well. But this does not mean that they don't have the responsibility to communicate to patients, you know, what the issues are. But as a health professional, as a doctor, I am expected to provide the patients with the appropriate education and guidance on risk reduction for COVID-19 infection. And how do doctors work? Well, we have to follow, and every province I'm sure is the same. In Manitoba, we follow the Manitoba Public Health Guidelines on mask use, on physical distancing, on hand washing. And that's what is expected of doctors today, you know, where none of us are experts in COVID-19. Most of us have had very little experience, but we are expected to ensure that our patients are listened to, that patients, that doctors have the time to have the important conversation with you, and they have to give you the time to understand the issues. And if they're not prepared to give you the time, then they certainly have to have a discussion and refer you to people who are prepared to discuss this with you. And I think we as doctors are informing ourselves every day about the implications of COVID-19. And you know, I'm learning every day. I mean, I can only say how much I've learned from listening to Dr. Clarke. And we doctors have to continue to learn every day about when children are at higher risk for COVID-19, how they might contract the virus while attending at school. And doctors have to use their knowledge base that's increasing, as well as their judgment in being able to work with you to come up with a decision that is right for you. We doctors are often being asked now to write exemptions for in-person learning at school. And doctors are continuing to ask us as the specialists or the subspecialists, when do I provide that kind of a letter? A medical note excusing a child from returning to in-person learning without jeopardizing their chances of re-entering the school system in the future. And I think we as doctors have to be sure that that does not happen, so that whatever decision is made today is not irrevocable, because this is a learning curve. We're learning every day more and more about the virus. So doctors have an obligation, and we're learning every day how to deal with the virus, what it means, but also to ensure they engage their patients, yourselves, in the conversation about what COVID-19 might mean to you. Your doctor might abstain from providing you with a note for an exemption from in-person learning. And I think this is unfortunate if it does happen, but you will have, I hope, other people in your medical team to approach for guidance in this area. The last thing that doctors want to do is provide inaccurate information. And we are as vulnerable to inaccurate information, what we read on Twitter or in social media, as anybody else. So doctors are also not obliged to provide a medical note of exemption if they feel it's not medically indicated or if it's not appropriate. So depending on your circumstances, I hope that each of your care providers will engage in the discussion, engage you in the discussion, and not opt out in providing you with guidance and information about what is the best decision for yourself. As I say, as doctors, we're obliged to adhere to the good medical care guidance that is within our defined in our standards of practice and the regulations that are in our own medical colleges. So that's kind of my overview of what we have to expect from doctors. Next, my thoughts in my role as a geneticist. Certainly listening to Dr. Clarke was very sobering. I think it's frightening. It's frightening for me as an older person who considers myself probably at higher risk, and it's frightening for everybody. But my overall feeling in my role as a geneticist for you people who are out there is that you are not strangers to uncertainty. When you were given a diagnosis of an MPS disorder, regardless of the type, you were told that it's a genetic disorder. You were given information about its natural history. You were given information about the recurrence risk to other children. And how did you make decisions at that up until today, what to do in terms of management of your child and reproductive decisions? You have been absolute experts in advocating for your child and in addressing the uncertainty that you've had to live with day to day since your child or yourself was diagnosed. So COVID has just added another enormous element of uncertainty. And I already know that you've all been able to deal with uncertainty. And that's what genetics is all about. It's talking about risk, but it's also talking about uncertainty. How do individuals deal with uncertainty? And I know our next speaker, Dr. Mamak, is going to talk about the different approaches about how you deal with uncertainty. And many people will be at either end of the spectrum. It's absolutely clear for many people that for us as a family, we have to normalize our day-to-day involvement and get back to in-person learning and minimize the risks to my child as much as possible. That is right for us as a family. And at the other end of the spectrum, if you listen to Dr. Clarke's talk, I don't think I'm going to get out of bed at Lorne anymore in the morning because there's always a small risk. There's a small risk in everything. But most people will be dealing somewhere in the middle, uncertainty. And that's why information sharing webinars such as this are so important. It will not tell you what to do, just like a geneticist and a genetic counselor do not tell you what to do with respect to reproductive decision-making. You're given all the information. And this is, as I say, a changing situation on a day-to-day basis. So try to consolidate all the information, and you know how to make decisions because you've been making decisions based on uncertainty for a long, long time. And I hope that you know that there is no right or wrong decision. You have to make a decision that is right for you. And I always said to my genetics patients, whatever you decide, don't look back. Don't second guess yourselves. There will be times when you would have made a right decision and times when it's going to backfire. That happens in real life, but don't look back, make the best decision you can. for many people, it's really important to try to normalize your lives and reestablish connections with in-person learning. And those advantages for many, many patients will strongly outweigh the disadvantages and the risks that Dr. Clarke demonstrate. I think that as I said, for every family, it's different. But I know that you've had the experience to making choices based on uncertainty, and you are a very resilient group. I mean, you were dealt a very serious card when diagnosed a child with an MPS disorder. And you think back just how you've been able to incorporate that into your lives. And this is just another blip. Somebody, for some reason, has decided to give us COVID-19 in 2020. And it's just something that we have to deal with. I hope, and I think Dr. Mamak will mention that as individuals and as families, you have to be sure you have enough personal supports around you. And I think that's really, really important. I mean, I've been home for 6 months, 7 months. It's incredibly hard, to be at home and to feel isolated. And, I haven't been able to see my grandchildren for 6 months. This is not an easy time for anybody. But I know that you are bold and courageous people and very resilient. And as people have said time and time again, we will get through this, and you will get through this. Will there be blips and decisions that you may potentially regret in the future? That might be, but don't beat yourselves up about that. You make the best decision based on the information that we have at the present time. The information is changing, almost on a day-to-day basis. But I know you are a very courageous bunch that are going to confront all these adversities that you face. So I don't have much from a medical point of view to share. I've tried to explain to you as doctors what our obligations are. I hope the doctors with whom you work do not abrogate their responsibilities, but help you through this process. I know that doctors are looking to you as experts to help in the decision-making process. And of course, you have to follow everything that Dr. Clarke says, because he's always right. There was one other thing I wanted to say. Yes, that hasn't been raised, in addition to encouraging everybody. One thing you haven't raised, Lorne, is how will a vaccine help us and help our families? You're talking about COVID-19 maybe going to the end of 2021. There is a possibility, if you get COVID-19, and I know children are vulnerable with MPS disorders, but treatments have improved, supportive treatments, even in the ICU, and I know these children are vulnerable, but treatments have improved, and I'm always the eternal optimist that maybe we'll be lucky and get a vaccine in early 2021. So that is my hope for you, and I'm hoping that I know that you will all be courageous and be able to confront this head on. So I think I will stop here and pass on to the next speaker.
Thank you. Okay, so lofty acts to follow, not acts again. So for this talk today, I'm sort of taking off my neuropsychologist hat and going back to the bare basics of my graduate school training in psychology, clinical psychology, because I think that there are very few factors that are truly neuropsychological that are important in this context. The emotional piece is far more important. So in the bare basics, I've shared before that by being members of the MPS Society, you guys are members of a select group, and that select group comes with certain risks for mental health. As I've spoken about in other contexts to this group, there's lots of reasons that pre-COVID, there were already increased risks for families with an individual with MPS in terms of their mental health, in terms of parenting, siblings, and partnerships, in terms of keeping those partnerships active and dissolution. COVID adds to that, unfortunately. So now on top of the increased risks that we have for mental health, we've got a crisis situation, and it's gradually shifted to more of a long-term crisis. And in that crisis, panic and anxiety is obviously very normal. So whatever panic, fear, and anxiety you're feeling, I'm right there with you. I've got a school-age child who is going into senior kindergarten, and I'm right there with you making some decisions right now. And I'm normalizing my panic as we're talking. The vast majority of us will get through this, and it will be okay. Every person has strengths. The people that I know on this call, I've seen those strengths in person, and we're going to use those to get through this. We may need some guidance in how to optimize how we adapt to this new situation, but we're able to do it. I have faith in all of you. So even 6 months in, we're sort of still at the early stages. And at this point, we're sort of looking at psychological first aid. And the nice thing about psychological first aid is that a psychologist doesn't have to provide it. What we're still looking for is things that are practical, supportive, connections with other people and social supports, looking at how to prevent any further harm, and trying to understand what is normal in this situation for many of us. The most important part of that, I think, and I think that Cheryl's already talked about this, is being connected to others and maintaining those social connections. I think that that's what's really going to get us through the next year or so. So if you have not found a lot of those connections, now is the time to start building them, and it's probably, unfortunately, going to be building them through virtual means. In terms of coping, in general, because I think before we can talk about education specifically and those kinds of decisions, we have to get our heads right as parents in terms of making sure that we're not making decisions based in fear and anxiety. So we have to get ourselves to a place where we're going to make the best decision for our situation with the information that we have, and that will change. So what can you do right now? Keep that routine going. Having a daily routine for yourself and your family is going to work no matter what your decision is. Strengthening existing relationships, we've already talked about that. It's probably going to be the thing that gets you through. Going back to the basics, making sure that you're all getting enough sleep, enough rest, adequate nutrition, some form of exercise somewhere during the day, and talking to someone. Those are the basics that you really can't move forwards unless you've got some of those things in place. And in terms of how to cope with your child, I think this is a very good time to have some input from your child as well about the decision about how education continues in the next few months. When we're making decisions, there is no zero risk activity and there's no perfect decision. We've talked about this a little bit. It's okay to make the best decision based on the information that you have, and it's okay to change your decision as more information becomes available. And hopefully you have support in making sure that those two things remain true. The other piece that I think it's really important to talk a little bit about is just how we communicate during COVID. I think that we are facing a time where communication is even more important than it ever was. Communicating about what supports your child's needs, what supports your child is receiving, how your child did during the day, whether you are at home or in person at school. Those things are more difficult to figure out. So for example, if you have a child attending daycare, gone are the days where you could chit chat with whoever the leader was at the end of the day, because you're picking up your child outside the school from a person that probably wasn't with your child all day because they're probably dedicated to just walking children in and out of the building. Communication has to be a lot more intentional. It's more effortful. It takes more time, but it's also more necessary. And on that note, as we give ourselves more that we have to do, that takes more effort and more intention, we have to just expect a little bit less of ourselves. Things will not go as perfectly as we would like them to go, and that's okay. It will work out in the end. But we do have to take our expectations of ourselves just a little bit lower to accommodate for all of the new things that we're being expected to do. So now when it comes to education specifically, I think we've already talked through a lot of the factors that we need to think about when we're looking at what choices are best for you and your family. Looking at the age of your child and how able they are to benefit from online learning. We got a taste of that in the spring. I'm not sure that we got a taste that will be accurate compared to what is expected for the fall for online learning. I think the expectations for online learning are far more intensive, at least from what I've seen in Ontario, which I think is a good thing. So think about whether your child is truly able to benefit from online learning and online teaching. Factoring in also the social and emotional needs of your child and how those are being met during the COVID confinement. So if there are large changes in your mood and anxiety level that you're noticing for your child, that's something to consider. How many opportunities do they have for peer interaction and how important is that to your child? It's a factor. Child anxiety related to COVID and how likely your child would be to overcome that anxiety is another factor. So if your child is going to spend the day worried behind their mask, think about whether that's going to be a productive face-to-face educational day. If that's not a factor for your child, that's something that you can decide. Something that I have not been able to answer for anybody, and it's going to be hard to find an answer to this, is the ability to access special education supports, both face-to-face and through online forums, given the increased infection control. It's going to be hard to manage. It probably won't happen immediately, and we're probably going to need to give school boards a couple extra weeks at the very least to try to implement those things in a new reality. But I think with that, we also have to think about school does provide some time for respite for parents or the opportunity to return to work. We have some return to respite services coming back online in Ontario. I don't know about the rest of the country. If that's not an option that is available and face-to-face school does provide some of that, that's another factor in your decision making. But I think really the most important thing, and is I'm going to echo Cheryl and say that you've all got a great deal of experience making very difficult decisions with not a lot of data and not a lot of information. And you're experts in this area. And so it's going to feel either very familiar or like a different version of this, but you've already done a lot of this yourselves. So I will end that there. And I know that there are quite a few questions in the chat. And maybe Dr. Clarke can take some of those.
The questions that have been asked are sort of very, very straightforward, pointed questions that I think now that you've heard these presentations, you can see that it's difficult to be prescriptive in answering them. The first question is, you know, my MPS 1H child is known to have lung disease. Should he go to school? Well, I think what's critical is you should be having this discussion with his care team to explore what is his current burden of lung disease. What were the last tests of his lung disease telling the medical team? But that then needs to be put into context with when you say, should he go to school? Well, my quick answer is, yes, he should go to school. It's a matter of what educational structure should he have. And again, it would depend very much upon that disease burden and exactly what type of school programs are actually available. So it's not a question that I think any physician should be just coming up with an answer, a straightforward answer, because there's so many variables that need to be explored and explored with you in order to understand what are the risks. So what one is balancing is always a risk-benefit ratio and it's going to be so individualized with respect to the disease that burden that the child has, but also the type of school system we're talking about. There are some schools that are going to get this really right, and there are some schools that are going to botch it. And so it's very difficult to answer that question. The next question is probably fundamentally a little bit more easy to answer, because we've had a lot of experience with other children with graft versus host disease. There's many leukemia, children with leukemia that are recovering from transplant that have graft versus host disease and are immunosuppressed. And for the most part, the recommendation from most of the childhood cancer centers is to try to keep children while they're immunosuppressed out of the school system. In that it is very difficult to keep them within a school situation while they're in their immunosuppressed stages. But again, it's a conversation with the school of, yes, the child needs to attend school. It's a matter of allowances need to be made or differences need to be made for that child who is on immunosuppressant medications for graft versus host disease. So for the most part, it really follows what we've had a lot of experience with cancer children. And the recommendation is usually to keep them out of that environment, but still provide schooling. Now, Cheryl, did you have? You're still on mute.
My right hand.
Oh yeah, of course.
No, I agree with everything you said, Lorne, about the BMT patients. What question that I'm getting is that my child has had a bone marrow transplant, is engrafted, is doing well, and is coming off immunosuppression. You know, there's those who remain on, and it's clear that they should not attend school in person while on immunosuppressives. And the ones who have completely come off, just like the cancer patients, if there's no other risk factors and other things being equal, they can go back to school. But the ones who are still a few months from and just being weaned from immunosuppression, I think the recommendation is to be cautious and to wait till they're off immunosuppression, and then they can go back to school.
Yeah, I agree. The next question really relates to an MPS 1H person that doesn't understand social distancing at all, and is constantly putting things in their mouth and is very close contact with adults. Again, I think there's going to be a number of MPS patients in this particular category: the Sanfilippo patients that are at their later stages of diseases, the later stages of Hunter syndrome patients who may not have been treated with enzyme, or even if they have been treated with enzyme with severe Hunter that have CNS disease. And again, I think it really relates very much to what type of resources are available at that school and in that school environment for that child. So I think the parents really need to explore what was done previously for that child. There was kids running around the school with infectious diseases before this. How was the school dealing with this child who has significant neurological impairment? So again, it's hard to be prescriptive here because it does really relate to what resources are available. It also brings up the previous discussion that Eva brought up is, the school is often an important component of some respite care for individuals that are at their later stages of disease, and that needs to be respected also. So again, I think it's having a conversation with the school of now in the COVID era, how is this going to be dealt with? But they clearly were dealing with that previously anyhow. Again, some schools you're going to feel comfortable with the program they have established, others perhaps not.
I might add to that that I'm less worried about kids who already have a dedicated one-to-one staff, because realistically, there's probably very inexpensive ways to make that one-to-one caregiving relationship quite safe.
Yeah.
They may have to invest in some additional PPE, but having been at the hospital for the last few months and seeing patients in person, it's doable. And how do we make it safe is the real question that you should be asking. And if the answer is we can't, then that leads you down one road. And if you can, and that's your family preference, then that leads you down another pathway. But I think it becomes much more difficult when a child's needs may not have been ideally met pre-COVID in terms of ratio of care. And now we're adding a lot more to that caregiving relationship within the classroom.
Yeah, a very good point, Siva. And that brings us into this last question. Adults have only masks. Is that enough protection for an MPS 1H child? I'm not quite sure, from what perspective that is. Again, it really depends upon the care needs of that child. If this is a significantly neurologically impaired child who has one-to-one care, masks are the most appropriate, but of course different PPE would be required based on other different circumstances. And so again, I think it really relates to the classroom environment, the new class environment, the new school environment that particular aid worker is going to find themselves in, which they may not be able to answer yet until school actually starts. But again, it's communication and conversations that the families have to have with the school and with those care workers.
Hi, thank you guys. Thanks to the panelists. That was super informative. Really appreciate it. I have just a couple of questions. One is in regards to siblings. So I'm trying to make a decision about my non-MPS child and whether or not it's appropriate or safe for him to go to school. And I think my worry is obviously that would just open our household up to the exposure. So my decision so far has been to keep him home. However, he's one of those kids that I think would benefit from going to school. Didn't do great with the online learning last spring. And I just feel like it's a tough call. So how much more risky is it if the non-MPS sibling was to go to school and I would keep my daughter home? That's a tough one.
Well, it's a tough one, but it's not such a tough one because, parents are still going to work, parents are still going out and buying groceries, parents are still doing all the things that, that families do. So I think that, that added level of risk is relatively small. I still think even for healthy children, families should be having this discussion and this expectation from the school that the program that they're going to have established come September is going to be implementable within the school, that it makes sense, that they have the resources in order to implement safety for non-MPS children as well. So I think, Lisa, it's equally important for you to have the same conversations we've talked about in relation to an MPS child for your healthy child.
Yeah.
And that if you're not comfortable with what is being established within the school, or also explore the options. You mentioned that the online learning didn't seem to have worked well. Definitely online learning is drastically changing, and the teachers are learning and schools are learning what is the more appropriate or best way for online learning. And there's a lot of discussion now about more of a blended, the opportunity of blended type of learning, where you have some online or distant learning, but then there is a meeting once a week where there's some face-to-face. So I think you need to explore with your school all of those potential opportunities, but I wouldn't necessarily conclude that because you have an NPS child at home that is of higher risk, that everyone else in the home needs to be shut down.
Yeah, that's good to know, because I spoke with his teacher from last year, and she said when kids started coming back in a modified way last spring, that she said, and this is grade 6, 7, that it was impossible to keep them distanced. So that's one thing that I heard from her that kind of made me question sending them back. And that leads into my next question, which is, you know, does it correlate to the fact that on the island here, you know, we have a fairly low number of cases? Is that something that should be used as a, you know, part of the decision-making factor, that correlation to number of active cases in your community?
Oh, absolutely. That's
Mm-hmm.
that's a component of the risk. The trouble is, it's very hard to quantify that because again, it is a moving target.
Mm-hmm.
And unfortunately, it's also a target that tends to be 2 weeks late in getting the data. Once you know you've got an increase or a spike in the number of cases, well, that likely all occurred about 5 to 10 days ago. And so, you know, but Lisa, it definitely needs to be factored in. If you're in a community that has very low positivity, clearly the risk-benefit ratio becomes a different ratio than a community that has a very high frequency of disease.
Yeah, thank you.
And that's why this is going to be a moving target even come September, that there may be schools that are doing very well in September, and they then have 8 or 9 cases creep up over a 1-week period, and the entire school is going to be closed. So it's going to be a quite a rapidly moving target.
Yeah, and I think it depends on where your trust level is with the school and how good they are with communication. I know that I feel like a bit of a cheater in that I did send my daughter to summer camp for part of the summer, and there was a very clear communication plan that if kids are getting tested, they would remain anonymous, but we would know that there are children who are being tested for some reason, in most cases because of symptomatic something or other. And if there was a positive case, then we knew what was going to happen from there. And there was a very clear plan that was communicated well ahead of time. Schools are working, and it's hard to work this quickly, but I'm hopeful that by the time school starts, we're going to have an equally clear plan of communication. But that'll be a factor as well.
You know, as well as the communication that the school is going to have with all parents about insisting on keeping children home who are not feeling well. Any child, the threshold now should be extremely low to keep a child home. And again, Lisa, what you need to feel comfortable with is that that communication is going on at the school to all parents. That come September 8th, when school is starting, the expectation is that no kid goes to school who is not perfectly well. Now that means a lot of kids are going to be kept home who may end up having nothing, but that's what you expect then to see. But you need to explore with the school, well, is that communication going out to all the parents? Is it being respected? And how is the school going to deal with little Johnny being dropped off because mom and dad, who are both lawyers, have to go to work and they're dropping little Johnny off with a snotty nose? Those are all the things I think parents need to be very comfortable with and expect the school to be able to deal, have the infrastructure to deal with. Whether they do or not is going to be very district dependent.
Yeah, it's hard to put your trust in that. And that's, like you said, part of the conundrum is really about the fact that it's ever changing. And for me, it's almost, in terms of like mental health, it's almost worse, harder to send him to school worrying every day. Has there been a case? Has he been exposed? Are they communicating properly? It's almost just better to to not be in
Well,
that
I think,
position.
I think you really need to respect your decision making.
Yes.
Like you've heard from Cheryl and you've heard from Eva, you guys are good at making decisions where there is limited data. And I think you need to feel really confident and respect yourself that the decision that you make is going to be the right decision.
Mm-hmm. Thank you so much.
And I will add to that, that your decision will be correct. And I think that related to comfort level with return, no matter what decision you make, it's going to be very difficult to be very comfortable with it for the first bit. I know that anybody who has returned to work after having stayed home for a bit has gone through this, and generally the longer that you've stayed home, the more difficult that return to work is. That's going to be the same thing for school, except that school has been out for almost 6 months now. So that's the longest delay that we've had. It's going to be very uncomfortable going back for the first few days. And that's going to be very normal because you haven't had that situation in half a year. Whether that continues or not is probably more related to the success of your decision making. So if it's going to continue with that discomfort long term, that's going to lead you in one direction. If that's going to be a temporary discomfort that you can gradually become more comfortable over time, it leads you down a different path. And unfortunately, it's really hard to predict which way it's going to go.
Mm-hmm. Thank you.
Yeah, well, my question is just that on the opposite, we took the decision to send our boy to the school because for now we feel comfortable with it, but because there's no way, because he's having a brain involvement disease, or he's having Hunter syndrome, so there's no way he can learn from online, and I'm not really a good teacher with them, so yeah, it's kind of hard. But I was just wondering if, I know he doesn't really have more risk to catch the disease, but if he catch it, he's kind of in good shape right now. But I was wondering if some of the members of the MPS community has been diagnosed with the COVID, and was it worse with them than the other people, or have you heard about something?
That's a very good question. And in fact, I had a conversation a couple of weeks ago with colleagues in Italy, as well as Minnesota and San Francisco. And believe it or not, no one's had a positive patient. And so we just don't know, except definitely the experience of COVID in other patients that have pulmonary disease and cardiac disease and obesity and diabetes are telling us that pre-existing cardiac and pulmonary disease appears to be the real emerging risk factor for the patients who don't do well. That doesn't mean that all patients with COPD and asthma don't do well. It's just when you look at the patients who don't do well, they have a much higher frequency of having these other pre-existing disorders. What's happened, I think, around the world with MPS patients, as we've heard from both Cheryl and Eva, is MPS families are used to making complex decisions. So what happened with the wave of COVID through Italy and through Spain and through European countries, the families kept their kids home and protected them. So we don't have any experience to suggest, although just intrinsically knowing that these children have pulmonary disease, one would say they're in a higher risk category.
Yeah. I kind of feel bad hearing you that I chose to send my boy to the school. It's just that,
you should feel bad.
Yeah, it's just that with Hunter there's as well the brain disease, and I felt that he regressed a lot in the last months. So I'm just thinking that maybe, you know, we're ready to take the risk to send him to school, and he will benefit it from, you know, being stimulated and
Absolutely.
yeah.
And I think you need
Another-
to, and I think you need to keep the communication lines open with the school and make sure that you're comfortable, but your decision making is clearly correct. You've balanced. This is a risk estimate. One
Yeah.
is for the same risks that parents have in choosing whether they should have a bone marrow transplantation in their child or start enzyme replacement. You're doing a risk benefit ratio, and you need to continue to have that communication.
Okay, thanks.
And I think you've added another factor that is really important to consider, which is if there is a need to close the schools again, is there any benefit in your child having established a relationship to the teacher that will be instructing them online? For some kids, that will be really important. So I think that that's probably related to your decision as well.
Okay.
Okay, thank you once again, Dr. Clarke and Dr. Mamak, and then of course, Dr. Rockman-Greenberg. We'll end this now. Again, if there's any questions that result from this webinar, please feel free to send them to the Canadian MPS Society at info@mpssociety.ca, and we'll work on another conversation with our families with another Town Hall Tuesday on the topics that are important to you. And we welcome any questions that you have. Please send them in to us. We'll try to be there as much as we possibly can to help you in these times that are very uncertain for everyone. And we wish you the best safety and health for your children and yourselves. And just be confident knowing that you are doing the best that you can for your children. So thank you once again. Bye for now. And please feel free to let us know if you have any further questions.
Thank you.
Bye. Thank you.
Bye-bye.
Good.